press star 0. As a reminder, this conference is being recorded Wednesday, June 15th, 2016. I would now like to turn it over to Dain, Executive Director of NCD Alliance. Please go ahead.
Thank you, and good morning or afternoon, everybody, and welcome to this NCD Alliance webinar. And apologies for starting a little bit late today. Today we have a packed agenda for you. This is the first webinar that we have done since the World Health Assembly, which took place a few weeks ago in Geneva. So our first agenda item will be from Alena Matzke from NCDA to give you the main decisions and the follow-up items from the World Health Assembly. Secondly, we will be giving you an update on the New York side of things. I will be providing a quick overview of the follow-up and review of the 2030 agenda that's currently being discussed in New York. Thirdly, a quick overview of the UN high-level meeting on HIV/AIDS that has just taken place in New York as well last week. Fourthly, we will be having an update from Jessica Beagley on UN Habitat 3. And then finally, we will be having an update on the EAT Forum, which has literally just taken place the last couple of days in Stockholm, where the new Global Nutrition Report 2016 was launched, and Alena will be giving that update. So with no further ado, let me pass over to Alena to talk you through the World Health Assembly.
Thank you, Katie, and good morning and good afternoon to everyone on this webinar. I'll start us off just going back to have a quick look at the long list of NCD-related agenda items that were discussed at the 69th World Health Assembly, starting with the WHO reform, specifically looking here at the framework for engagement with non-state actors, which finally, drumroll, was adopted at the WHA this year, so very exciting, and hopefully will allow WHO to move their work on NCDs forward more swiftly. Then item 12, which is entitled Non-Communicable Diseases, and under this item we see maternal, infant, and young child nutrition, the report of the Commission on Ending Childhood Obesity, draft global action plan and action on violence, and then preparations for the 2018 high-level review, as well as strengthening synergies between the World Health Assembly and the Conference of the Party of the FCTC. And then the UNGAS on the World Drug Problem. Next slide, please. Item 13 on promoting health across the life course. Here, of great importance, health in the 2030 Agenda for Sustainable Development, as well as the Global Strategy on Women's, Children's, and Adolescents health. Equally important, the draft Global Plan of Action on Aging and Health, the roadmap on air pollution, and then as well also the role of the health sector in the sound management of chemicals. Item 16 on health systems. There was an agenda item that incited a lot of discussions on addressing the global shortages of medicines, and then also the progress report on strengthening of palliative care. Next slide, please. All right, so I'll start with a more in-depth look at 12.4, the agenda item on the preparations for the UN high-level meeting in 2018. Member states adopted a resolution that urges the acceleration of implementation of national time-bound commitments, so the commitments that were made in 2014 specifically for achievement by 2015 and 2016. The resolution highlights here in particular the need to strengthen surveillance systems for NCDs in the lead-up to the high-level review in 2018. The resolution also notes the process to update Appendix 3 of the WHO Global NCD Action Plan and requests the WHO Director General to submit an updated Appendix 3 to the World Health Assembly next year in May. It endorses the process to develop an approach to register and publish contributions of non-state actors to the achievement of the 9 global targets and again here requests the WHO Director General to submit a report setting out this approach to the 70th World Health Assembly. The resolution also includes a note on the submission of the working group reports of the Global Coordination Mechanism on NCDs to the WHO Director General, which provides the Global Coordination Mechanism with a mandate to develop more tools for member states to implement the recommendations of the working group. And finally, it requests the WHO Director General to continue to provide technical assistance to member states, including in the two areas covered by the 2015 GCM NCD working group report. Next slide, please. Okay, so I'm just going to spend a little bit more time specifically on the Appendix 3 and the Register of Contributions from Non-State Actors. I've included here, the links are not active yet, but once we send around the slides after this webinar, you'll be able to click on all the hyperlinked links here in this presentation. So at the top of the slide, there's a link that you can follow that will provide you with more information available on the WHO website on the process and the timeline to update the Appendix 3 of the Global Action Plan on NCDs. For all of you not familiar with the Appendix 3, it's the list of interventions, the best buys, and the cost-effective and very cost-effective interventions for NCDs. And this appendix was always supposed to be updated, which is in fact this process to review the appendix is now underway. It started last year in June 2015 with the first expert meeting, which advised the Secretariat on the methodology to update Appendix 3. Currently, the Secretariat is completing the economic analysis of existing and new interventions for Appendix 3. And then on the 27th to the 28th of June, at the end of this month, a second technical expert meeting will take place at the WHO headquarters here in Geneva to advise the Secretariat on specifically on the presentation of the revised Appendix 3 and implementation considerations to make sure that the interventions presented in Appendix 3 are easy to adapt to country context. On the 22nd of July, the preliminary updated Appendix 3 is expected, and then there'll be a period for web-based consultation between July and September that will be open to relevant stakeholders, including NGOs, and we will certainly be inputting into this consultation. On the 24th of August, there will be informal consultations with member states, and a day later, on the 25th, there will be informal hearings with non-state actors, including civil society. So these two, the date, the 25th of August, and then also the web-based consultations is something that you should be marking in your calendars if you are engaging on this topic. And then on the 7th of October, the final draft appendix, the final draft updated Appendix 3 is expected to be submitted for consideration by the Executive Board in January, and then will go to the WHA in May 2017. The Register of Contributions from Non-State Actors was actually called for in the 2014 outcome document on NCDs in paragraph 37. And so this paragraph calls for an approach that can be used to register and publish contributions of the private sector, of philanthropic entities, and civil society to the achievement of the 9 global targets. Between August and October, a zero draft approach will be published and will then be open for web-based consultation with member states, human agencies, and non-state actors, including civil society. And then same as the draft updated Appendix 3 in October, the Secretariat is expected to submit a revised draft for consideration by the Executive Board in January and for consideration by the WHA in May 2017. And at this point, I just want to say if you or your organizations are doing work around this register, as well as or the Appendix 3, please do let us know so that we can work more closely together on this topic. Next slide, please. All right. So another item I want to touch upon on 12.4 is the report that will go to the UN General Assembly in 2017. The report that went into the WHA this year has included an outline of what this report will look like. There'll be 6 chapters, more broadly looking at where do we stand in terms of outcomes and processes, then looking at progress made in realizing global commitments and assignments in 2011 and 2014, progress made in realizing the 4 time-bound national commitments, looking specifically at international cooperation for NCDs, and then looking at recommendations. A very important part of this report, the recommendations for what needs to happen towards 2025 to make sure that the 9 global targets will be achieved. And in an annex to this report, for the first time, there will be national data on progress achieved at the country level. So there'll be a 2017 version of the NCD Progress Monitor, including detailed information on every single country. So the 2018 high-level meeting is really critical as it's halfway between 2011 and 2025. It will be incredibly important to see what countries have achieved, where course corrections have to be made, which sort of really leads us to the big question that we as the NCD Alliance, but also you as part of the NCD community have to be asking yourself in terms of what kind of recommendations do we want to see agreed at the high-level meeting, what needs to happen between 2018 and 2025 to ensure the achievement of the 9 global targets. One very clear advocacy message that we can already send out now really is that we want to see a comprehensive consultative process ahead of this the 2018 meeting, and this should include regional consultations and definitely consultations with civil society, such as took place ahead of the 2011 high-level meeting on NCDs. Next slide, please. At this point, I want to provide a brief update on the work of the GCM working groups that have been set up for 2016 and 2017. Next week, there will be meetings of the working group on inclusion of NCDs and other programmatic areas. These will take place on the 20th and the 21st, so Monday and Tuesday of next week. There is a link here as well with more information on this working group and the meeting. The expected outcome of the meeting will be an interim report, including preliminary recommendations achieved for integration and possible typology, key elements for integration, and further areas to be discussed at a 3rd working group meeting, which will most likely take place on the 26th to the 27th of September. The 2nd working group will meet just the day after, on the 22nd to the 23rd. This working group is on alignment of international cooperation with national NCD plans. There's no information yet online, but what I can tell you is that both working groups will have a stakeholder components. So the first day of each meeting will be dedicated to a hearing with a variety of stakeholders. And both of these stakeholder hearings will be webcast. So Monday next week and then also Wednesday next week will be webcast. There's no link yet for the webcast, but it will be posted on the WHA69 NCD Working Group web page. In general, I understand that the interim reports that will come out of the reports of the working groups more general aim to be less heavy in terms of political jargon. They're meant to be a bit shorter, more visual than the working group reports that came out in 2015, and they will be submitted to the WHO Director General by the end of this year. The third working group that was set up for the time period of 2016-2017 is the working group on health literacy. And here it's quite interesting to see that even though the working group will only take up its work formally early next year, there's already been a community of practice that has been set up for the working group members. It's a closed community of practice by invitation only, but working group members are already engaging. And one of the reasons is that, as you may know, there is a conference on health promotion in the Sustainable Development Goals with the slogan Health for All and All for Health. And this conference will take place in November from the 21st to the 24th in Shanghai. And it is my understanding that the WHA69 is working with the conference organizers on making sure that the working group will be able to participate in some form on the panels of the Shanghai conference. The objectives of the conference really are to renew the mission of health promotion in the coming decades, to provide guidance to countries on the practical application of health promotion and how to address the social determinants of health in order to achieve the SDGs, and to exchange national experiences in improving health literacy, intensifying action across sectors and social mobilization, and creating healthy cities and communities. The first meeting of the working group will then, is then likely to take place in February 2017, so as early as possible. Usually the January, the month of January is taking because of the executive board. So right after the executive board, the working group will convene in February to keep the momentum built at the conference. Next slide, please. Great. So coming back to the WHA after this short diversion to the work of the Global Coordination Mechanism, there's a lot of attention on NCDs and nutrition at the World Health Assembly, and the Assembly adopted a total of 3 resolutions. 2 of them fall under the agenda item on maternal, infant, and young child nutrition. The first one was about the new WHO guidance on ending inappropriate promotion of foods for infants and young children. There was week-long negotiations around this resolution because the ambition had been to endorse the resolution. In the end, to endorse the WHO guidance, in the end, member states agreed to welcome with appreciation this new guidance, reaffirming the need to promote exclusive breastfeeding during the first 6 months, and then also continuation of breastfeeding up to 2 years. And beyond, the resolution calls on member states to implement the 7 recommendations of the guidance and to monitor their implementation, and then request the WHO Director General to report on implementation in 2018 and 2020. And just to kind of recall the importance of this resolution for the NCD community, we obviously all know that there are tremendous health benefits to breastfeeding for young children and also mothers, and breastfeeding can also lower the risk of obesity, diabetes, and even childhood leukemia. studies say that mothers who breastfeed are less likely to develop type 2 diabetes, breast cancer, and ovarian cancer. And the guidance also addresses specifically complementary foods, so foods that are marketed for children up to the age of 3, and often these products these days include high amounts of sugar and fat. The second resolution that was adopted is on the UN Decade of Action on Nutrition, which was proclaimed by the UN General Assembly in April this year. This Decade of Action is a UN-led initiative to set, track, and achieve smart commitments to end all forms of malnutrition with and for the Sustainable Development Goals. The resolution at the WHA welcomes this decade and urges member states to set national nutrition targets and develop smart policies and foment financial commitments to implement the framework for action of the second International Conference on Nutrition, which you probably know took place in 2014. And this UN Decade really is a unique opportunity for the NCD community and a platform for raising the profile for avoiding obesity and nutrition-related NCDs, and call for smart commitments in the follow-up to the ICN2. The resolution also requests WHO and jointly with FAO to maintain a database of commitments, so keeping track of what kind of commitments are being made on NCDs. And if you're interested in learning more about smart commitments for NCDs for overweight and obesity, we just published a policy brief at the WHA, which is available in English, Spanish, and French on our website. And again, there's a link here on the website for you to follow up on after the webinar. Next slide, please. So the third resolution that was adopted at the WHA is on the report of the Commission on Ending Childhood Obesity, which came out earlier this year in January. The resolution welcomes the report and recommends to member states to develop national responses to end childhood and adolescent obesity based on the report's 6 recommendations. It mandates WHO with the development of an implementation plan in consultations with member states and other relevant stakeholders for consideration by the World Health Assembly in 2017, always going through the Executive Board in January 2017. And really here there's an important advocacy window from between now and October for the NCD Civil Society to ensure that the integrated package of interventions that was recommended by the Commission remains intact, and that there's no cherry picking for this implementation plan, and that the plan also includes a robust monitoring and accountability framework, which is actually not mentioned in the resolution, which is a bit concerning. The Commission's final report, if you haven't had a chance to look at it, can be accessed through the link included on the site. And it's really important to remember that even though WHO has been requested with the development of an implementation plan, countries really can and should start implementing the report's recommendations now. There's no need to wait. The resolution specifically calls on member states to develop these national responses, and the plan will then sort of be a common roadmap, but action can start much faster. And from the discussions at WHA, it seems that a lot of member states are keen to do so, or actually have done so already with taking, or have started to take measures to address childhood obesity. Next slide, please. Okay, so a little bit more on NCD-related discussions at WHA. So there was quite an interesting side event on physical activity. It was great to see more attention given to physical activity, which we haven't so much in past years. The side event was also co-hosted by the WHO, which is a great sign of commitment towards the target on physical activity within the global monitoring framework for NCDs. very interestingly, there were calls by the WHO African region, as well as Thailand and Sri Lanka during the official discussions on the NCD, calling for a framework convention on alcohol products. So I think there's going to be a lot of discussions in the coming months around this, and it's great to see much greater attention given to physical activity and alcohol. Finally, just a quick note, as discussed on our last webinar, NCD Alliance teamed up with great partners on a side event on childhood nutrition and overweight and obesity, which was hosted by the government of Finland, and we had a great turnout of ministers of health, including Brazil, Canada, Bangladesh, UK, US, Kenya, Chile, Zambia, and other countries participating in the event and making commitments to address malnutrition in their countries. And if you're interested in learning more about the event, there's a link to a blog written by the co-chair of the Global Nutrition Report and moderator of the event, Dr. Kuna Hawks, which I've included here on the slide. And in general, if you wish to find more updates on the World Health Assembly, there's also links here on this slide for you to read up on the different agenda items. Next slide, please. We're not finished, though, with the WHA yet. Moving on to Health in the 2030 Agenda. Under this agenda item, we saw two resolutions adopted, which shows the great importance member states are giving to Health in the 2030 Agenda. The first resolution is around universal health coverage. It aims to strengthen the essential public health functions in support of achievement of UHC and urges member states to establish effective health governance via integrated strategies and intersectoral action to enhance international cooperation for health, invest sustainable resources for health systems strengthening, and to build capacity for data collection, monitoring, and evaluation. The second resolution, next slide please. The second resolution reaffirms the need to accelerate the fight against antimicrobial resistance, Ebola, and other epidemics, neglected tropical diseases, and NCDs, and requests the Director General to promote a multi-sectoral approach and proactive engagement of WHO at all levels of implementation of the Sustainable Development Goals. Very important ask in the resolution is the development of a long-term plan for maximizing the impact of contributions of WHO at all levels. It's here to note that we think it's very important that in the development of this long-term plan, which will be in cooperation with member states, civil society has to be engaged. The resolution supports member states in capacity, the resolution requests the Director General to support member states in capacity building, providing technical resources, and strengthening research and development. And then finally, another really important ask is that the Director General report to member states at least every 2 years on global and regional progress against the SDGs. Next slide. Okay. On this last resolution, the Health Info 2015 NGO group formulated a letter to the WHO Director General, in which they commend the WHO and member states for agreeing a resolution that includes regular reporting. This reporting is really important to facilitate follow-up and review at the high-level political forum, the first of which will happen this year in July. It urges the WHO to ensure refinement of the indicator 3.8.2 so that it appropriately measures financial risk protection. It recognizes the need to address antimicrobial resistance and requests WHO to ensure a transparent and participatory process with meaningful engagement of CSOs. And again, at the bottom of the slide here, there's the link that will allow you to read the letter in full. Next slide, please. The agenda item on women's, children's, and adolescents health looked in particular on the implementation of the new global strategy for women's, children's, and adolescents health. Member states and the WHA adopted a resolution which invites member states to commit to the implementation of the global strategy, which many member states have already done, and to strengthen accountability and monitoring systems at the national level to monitor national progress. It importantly, from an NCD perspective, the global strategy includes a target or includes targets to reduce premature mortality from NCDs and ensure mental health and well-being. The resolution invites relevant stakeholders to contribute to implement the global strategy and requests the WHO Director General to provide adequate technical support in order to update and implement national plans on women's, children's, and adolescents' health. And finally, and also very importantly, it calls for regular reporting on progress through the Executive Board to the WHA on progress in implementing the global strategy. Next slide, please. Much higher on the agenda these days at the WHO is health and the environment. Here specifically, I'll be covering two items. The first one is on the roadmap for an enhanced global response to the adverse health effects of air pollution, which was welcomed, not endorsed by member states. Again, interesting, it's a bit more of lukewarm support for the roadmap, and endorsement is much stronger. In their interventions, many member states noted the links between air pollution and NCDs and the need for intersectoral action, and this was also highlighted in the response to member states' interventions by the Secretariat, which is great to see. Interestingly, there was an indicator framework and also details and costing for the implementation of the roadmap that was expected for the WHA, but never really materialized. So this is still outstanding, but we don't know at this point when this information will be made available. And finally, the WHA requested the Director General to report on progress on implementing the roadmap at the 71st World Health Assembly, so in 2018, and then also 2 years later on the achievement of the roadmap. Next slide, please. Another item that we have been following, given the links to NCDs, has been a resolution on the role of the health sector in the international chemicals management. The resolution is really framed around the so-called 2020 goal, which is part of the strategic approach to international chemicals management adopted by the International Conference on Chemicals Management in 2016. And this goal is that chemicals are used and produced in ways that lead to the minimization of significant adverse effects on human health and the environment. And the resolution at the WHA requests the Director General to draft a roadmap outlining concrete actions to enhance the engagement of the health sector towards meeting this 2020 goal, as well as to contributing to relevant targets in the 2030 agenda. And this roadmap will be developed in collaboration with stakeholders, including civil society, and should be presented to the next World Health Assembly in 2017. And from our perspective, it will be quite an interesting process to engage with in terms of better highlighting the links with NCDs in this process. Moving on to the next slide, the historic adoption of the WHO framework for engagement with non-state actors. This process has been going on for a long time, 4 years, and finally member states achieved the agreement. The framework was adopted on the very last day of the WHA, with member states having negotiated the framework all week long. A reminder of what FENSA actually is. So this framework is a framework of engagement between the World Health Assembly, the World Health Organization, and 4 types of non-state actors. So the framework classifies non-state actors as NGOs, academic institutions, philanthropic foundations, and private sector entities, and differentiates between these 4 types. FENSA then consists of one overarching framework, which applies to all engagement with non-state actors, and then 4 specific policies and organizational procedures for each type of non-state actors. FENSA applies to all 3 levels of WHO, global, regional, and national, and recognizes and encompasses different forms of engagement, such as participation, resources, advocacy, technical collaboration, and is really far more inclusive than just accrediting non-state actors to participate as observers, as has been practiced in the UN system more generally. How will FENSA be implemented? The resolution with which FENSA was adopted calls for calls on WHO to begin implementation with immediate effect, with a view to achieving full implementation at all levels of the organization within the next 2 years. It also calls on the WHO to expedite the establishment of a register of non-state actors in time for the next WHA, and I've included here a link to a prototype that is accessible already. This prototype will be expanded, but it's interesting to look at to see how this register will look like. A guide to staff will be developed to clarify the details of FENSA implementation, in particular around measures pertaining to policies on conflict of interest. And then there will be an evaluation that will be conducted in 2019, and the results will be submitted for consideration to the Executive Board and the WHA in 2020. And at this point, there may also be some proposals for revision based on the evaluation in 2019. Next slide, please. Okay. 2 other relevant items. The first one being strengthening synergies between the World Health Assembly and the FCTC Conference of the Parties. It's a very short resolution, but there's a lot of discussions on this resolution at the WHA, and finally the WHA decides that the FCTC Conference of the Party may consider providing a report from information to the WHA on outcomes of the Conference of the Parties, and the Conference of the Parties may equally consider inviting the World Health Assembly to provide a report to the COP on WHA resolutions and decisions that are relevant to tobacco control. A lot of good progress on aging and health and dementia. So during the WHA, a global strategy and plan of action was adopted. This plan of action is for 2016 to 2020, and the resolution requests the WHO Director General to prepare a global status report on healthy aging for the 73rd WHA, and to inform and provide baseline data for a decade of healthy aging, which is planned for 2020 to 2030. And the resolution also requests the WHO Director General to report on progress in implementing the global strategy and plan of action at the WHA in 2018. Right after the WHA, the 139th Executive Board took place and adopted a resolution that requests the WHO Director General to develop a global action plan on dementia for consideration by the World Health Assembly next year. And this plan of action on dementia will be developed in full participation with member states and also in cooperation with relevant stakeholders. So very exciting for the dementia community here, a big advocacy win for them, and really significant for moving forward on dementia. Next slide. So we're almost there. It's the last agenda item which I'll be covering on this webinar. And this agenda item is on addressing the global shortages of medicines. And we started out with first one resolution, and then suddenly we had two resolutions that were adopted at the WHA, showing how important this agenda item is for member states. The first resolution is entitled Promoting Innovation and Access to Quality, Safe, Efficacious and Affordable Medicines for Children, and urges member states to implement appropriate policies and action to increase access to quality, safe, effective, and affordable medicines for children. The second resolution, which was adopted after several amendments and changes to its name, is on addressing the global problem of medicines and vaccine shortages, and urges member states to adopt responsive regulatory frameworks with effective notification systems and to consider comprehensive measures to address the different obstacles affecting the price of medicines and vaccines. And the World Health Assembly requested a report on progress and outcome of the implementation of these two resolutions to be presented to the World Health Assembly in 2017. Next slide, please. So I'll be wrapping up this presentation on the WHA with just a quick overview of a variety of publications that we have produced in the last few months. First of all, if you haven't checked out the annual report, our latest annual report, it's available on our website. As mentioned before, we have produced a policy brief on smart commitments for NCDs and obesity. There's a great report on realizing the potential of workplaces to prevent and control NCDs, which is produced with, by the NCD Alliance and WHA, and I should say the Smart Policy Brief is a collaboration between the NCD Alliance and the World Cancer Research Fund International, and then a variety of other publications that are available in many of them also now in English, French, and Spanish on our website. Next slide, please. We've also really used the WHA, but also Women Deliver earlier, as an opportunity to produce more infographics. All of these are available on our website as well. Really great infographics on women and NCDs, on NCDs and nutrition, on NCDs and climate change, NCDs in the 2030 agenda. All of these are tools that are there for you and that I really encourage you to use in your own advocacy. Please let us know if these are useful, and we'll do our best as well to provide these kind of resources increasingly in English, French, and Spanish. Thank you very much so far. This is it for this first segment of the webinar.
Thank you very much, Alena, for that really comprehensive overview of the World Health Assembly. We haven't got any questions in the chat facility at this point. I'll take the chair's prerogative to ask a couple of questions while they come in. So, Alena, hearing you present there, the main takeaways seem to be from WHA from a policy perspective, obviously the adoption of FENSA being a major milestone. From an NCD perspective, there was a strong focus on the risk factors this year. Great to see a strong focus on alcohol, nutrition, physical activity. And also then the adoption of the resolution on the Dementia Action Plan, which will be continuing through to next year. And then also obviously the focus on Agenda 2030, establishing that regular reporting every 2 years into the World Health Assembly on Agenda 2030. My question is, there was obviously another whole discussion going on during the World Health Assembly this year, which was less about policy, but more about who is going to be the next WHO Director General. Obviously that whole process is really heating up in the background. Can you give us a quick update of kind of where we are in that process?
Yes. So there is indeed a lot going on in the background, and it's kind of interesting to see. There we have the appointment of the Secretary General of the UN, and then we have the election of the WHO Director General taking place just a few months apart from each other, so a lot of movement, let's say, in the health and broader UN space. So the next steps for the election of the Director General of the WHO by September, we should have a clear idea of who is actually out there running for the post, and then we'll have a forum for member states where the different candidates will make their case. I understand that it's a closed event though to member states, and that will take place sometime around November, and then by the executive board in January, we'll have 3 candidates that will be put forward for election at the World Health Assembly. And at the World Health Assembly, these 3 will also be able to address the World Health Assembly. The World Health Assembly will then, under a secret procedure, elect the next WHO Director General, which will then take office in July 2017.
Great, thank you, Alena. Yeah, absolutely. And another quick follow-up question around FENSA. So maybe it's too early to say, but do we know what the kind of implications are going to be of the new FENSA policy for the WHO Global Coordination Mechanism? Obviously, as a mechanism that's engaging lots of different non-state actors, whether that impacts upon the way that they work?
Mm-hmm. Yeah, so when the Global Coordination Mechanism was established, there was well, there is still something called Information Note 1, which details which organizations can become participants in the Global Coordination Mechanism. And this information note is a bit strange because the language is quite interesting or particular, because it says that you either have to be in official relations with the WHO, or you have to have had engaged in specific NCD-related processes up until this point, which seems a rather strange way of identifying criteria for participation. So this information note will be revised, and the Global Coordination Mechanism has a lot more freedom based on FENSA now to actually set out criteria for becoming a participant in the Global Coordination Mechanism. But it's still really hard to say how FENSA will really affect the work of the WHO more general, and then the Global Coordination Mechanism in particular. It's definitely quite clear that the WHO will be very careful in the first 2 months in following the WHA, as there's a lot of eyes on the WHO watching their steps on FENSA. So I think it will be a while until we can see more clearly how it will affect the organization. But it seems like WHO is very pleased with the adoption of FENSA, and that the GCM NCD Secretariat feels empowered to move their work forward on these duties.
Great, thank you. And just one other question on FENSA. We're getting a few coming through as well, which I'll address in a second. So in your presentation, you mentioned that within the FENSA process, the next steps was to develop a register of non-state actors in time for WHA next year, so WHA70. But we also know within the NCD space that in the NCD paper they were talking about developing a register of non-state actors for NCDs specifically. Do we know how these 2 registers are going to dovetail, or not at this point?
They're very different, despite the commonality of being called registers or registries. But they're very different. They have very different purposes. So the more general register of non-state actors is a means to have greater transparency of who WHO engages with. So it's quite interesting to follow or to have a look at that prototype, and it essentially just includes a lot of detailed information on the organizations that WHO is engaging with. So the prototype really only includes, I think, NGOs in professional relations, and now in this new register that will be finalized for WHA next year, all engagements will be included. So also those organizations that WHO engages with but is not in official relations with. Whereas the registry of contributions to the NCD response has a different purpose, and the purpose here is to have an overview or an opportunity, sort of a platform for different non-state actors to show what they're doing on NCDs. I understand that in the first instance, these contributions will sort of be listed but not necessarily analyzed or critiqued. But again, this whole process is underway and needs to be, the approach taken needs to be further defined and developed. And there will be opportunity to engage in this process. But they're very different things, because the first one is really just looking at who is WHO engaging with and detailing information on the organizations that WHO is engaging with. And then the second one is specifically around what organizations, non-state actors are doing to achieve the 9 global targets on NCDs, but not so much on who they are as an organization, if that makes sense.
Right. Yep, absolutely. Thanks for clarifying that. We've received a question from Mohammed Credden, who asks, what can research institutions do to better understand their role with new WHA policies on integrating non-state actors, essentially the FENSA policy? So what can research institutions do?
What can research institutions do to better understand their role?
Yes.
Is that the question? I'm not entirely sure I understand the question. Probably, research institutions fall under academia, and so one of the best ways of finding out more about how research institutions fit into the new framework of engagement with non-state actors will be to go to the framework and read the specific sections that pertain to academia and research institutions. And then I think if there are very specific questions, it will be most useful to reach out to the WHO directly and address these questions.
Great, thanks. And I think it's fair to say, isn't it, with FENSA, that it's going to take a while before we're really seeing it kind of being implemented and getting into place, and seeing what the implications are for the different 4 types of non-state actors involved in that. Alena, just one more question before I let you go. So you're obviously talking about the decade of action on nutrition, which is great to have seen being adopted. And you also mentioned that we're beginning to move towards a decade of action on healthy aging potentially as well. With the decade action on nutrition, obviously there's been many, many different decades of action over the years. How do you see this one being different? What are going to be the kind of key ingredients to making sure that it has an impact?
Good question. So I think that the decade of action on nutrition is really powerful, because it seeks to integrate and better coordinate and unite all of the different initiatives and programs out there on nutrition. Obviously, in the nutrition space, we have seen this move towards acknowledging the existence of malnutrition in all its forms, so focusing away from only looking at undernutrition and hunger and micronutrient deficiencies, more towards the larger spectrum, which also includes overweight and obesity and increasingly nutrition-related NCDs. So that's sort of one aspect, and I think there can be a lot of synergies achieved in the space, as the root causes of all of these different forms of malnutrition really originate from the same place, which is in our food system. So the decade of action on nutrition will serve as a vehicle to better integrate the work of the World Health Organization, but also the work of the Food and Agriculture Organization, which sits in Rome and looks more at the food and food systems, agriculture, and whereas obviously WHO looks more at the health side of things. So I think there's vast potential. I think that it will certainly take a while to really map out what the exact program of work for the decade is going to be. So this year, by December, we should look at a consolidated plan of work for the decade. And currently, there's a lot of groups that are coming together discussing what the decade means for their work and how it fits with current initiatives, how it fits with the whole Nutrition for Growth. With the whole Nutrition for Growth initiative, which has been a great platform for making commitments towards nutrition, how it fits with the SUN movement, the scaling of the nutrition movement. But as I said earlier on the webinar, I think it is a great opportunity for the NCD community, really, because we're not part of the SUN movement in any significant way to date. For NCDs and overweight and obesity have not been acknowledged in any significant way in the Nutrition for Growth process. And so the decade being framed around malnutrition in all its forms, acknowledging the ICN2 framework of action is really sort of a reference point for action and for making and formulating commitments. And then the SDGs, which obviously addresses all the different forms of malnutrition, that we really it's a great platform for the NCD community to call for greater action and commitment towards the overweight and obesity in NCDs.
Great, thank you. And we have a really important question that's come through from Beatrice Champagne from the Healthy Latin America Coalition, and it's on. We're going back to FENSA. So she says the final rules expressly permit business interest groups to participate in the governance of the world's chief public health agency and replace the stated policy that WHO should not engage with organizations that are primarily of a commercial or profit-making nature. So her question is, has FENSA actually weakened WHO by permitting or at least confusing these relations to actually occur?
I'm certainly not the authority for saying yes or no on this question. I think different people look at it from very different standpoints. I think there is definitely concern about the influence on industry groups around the presence of these groups at the governing body, at the meetings of the governing bodies of the World Health Organization. It's still FENSA doesn't allow a place for industry in policy making though, and I think from an NCD perspective, paragraph 44 this, which as mentioned on previous webinars as well, is quite important because it calls for greater caution when engaging with industries that have a negative impact on health outcomes, and very specifically singles out NCDs as an area of particular attention. So I think there's different ways of looking at it, and depends on where you stand. I think, to be quite honest, I think that it will really show in the implementation of FENSA. I think it depends on how WHO will really move forward on implementation of the framework. Yeah.
Great, thank you, Alena, and thank you for those questions. So in the interest of time, we need to move on to the next part of our agenda, which is moving from the World Health Assembly in Geneva to a few updates of what's been happening in New York on various related items. Next slide, please. So I'll start by talking a little bit about the UN Interagency Task Force on NCDs. As a reminder, this was set up a couple of years ago to bring together all of the whole UN system to focus on NCDs. So WHO very much at the helm, bringing together the whole set of UN agencies, funds and programs to focus on NCDs. And it was originally an expansion of a UN task force on tobacco control. As mandated, what happens with the UN Task Force is that every year, annually, the Task Force reports into ECOSOC in New York. And so this has just taken place on the 2nd of June. And what happened there was basically that the UN Task Force presented a report on progress of what's been going on with the UN Task Force. And just a reminder as well of the Task Force, it's both focused at the global level, so various different UN agencies working together around global programs, as well as actually having quite a strong country focus. And the country focus has been done over the couple of years through country missions. So UN agencies going together to be talking to governments in specific countries and then coming up with a roadmap and a plan of how to really strengthen particularly the way that they're working multi-sectorally on NCDs. And there's been various different country missions over the couple of years, and those can be read up in the report that was discussed in New York on the 2nd of June. But importantly, what was discussed in New York as well was actually that a resolution was adopted around the UN Task Force. And that resolution had 4 main focuses, really. The first one was to just very much note the report of the Interagency Task Force, so that's not of huge interest. The second one was to really encourage members of the Task Force, which are obviously these many different UN agencies and programs, to continue to work together in a coordinated and coherent manner, both at the global level and at the national level on non-communicable diseases. So that's really just reinforcing the kind of the mandate and the need for the UN Task Force. I think where the resolution is particularly interesting is the third point, which really focuses on and actually basically expands the mandate of the task force to focus on encouraging members of the task force to provide support to member states in reflecting the new NCD-related targets in Agenda 2030 for Sustainable Development. And the way that they're saying they should do this through the resolution is by including NCDs in national development plans and policies, and also obviously by encouraging the task force members to be leveraging their expertise to support member states in accelerating progress on NCDs in Agenda 2030. So that basically really shifts the UN Task Force's focus from purely focused on the UN Political Declaration on NCDs, the high-level review, outcome document, and the global NCD targets, to very much shifting towards the Sustainable Development Agenda as well. And obviously when you're looking at the membership of the task force and you've got the World Bank, you've got UNDP, you've got UNICEF, you've got UNFPA, you can see that that actually has a huge amount of potential both at global level, but also, I think particularly interestingly, at the national level. So that's what just took place in New York for the UN Interagency Task Force, and I really encourage you to take a look at the report on progress, which can be found on the UN Task Force page, but also have a quick look at the resolution as well. Next slide, please. Secondly, I wanted to give you a quick update of where we are in terms of the follow-up and review of the 2030 agenda. This is really the last piece of the Sustainable Development Agenda being discussed. Obviously, goals and targets were all adopted last year, but this has been continued to be negotiated for this part of the year. And so, as we all know, the high-level political forum, which takes place in New York, between the 11th and the 20th of July this year, is really where it's going to be the central platform for assessing progress towards achieving the Sustainable Development Goals. And that's obviously important for the NCD community now because NCDs are in firmly the Sustainable Development Goals for the first time. So what is being discussed at the moment is, well, obviously the high-level political forum is coming up very shortly, so just next month. And what we're going to be seeing at this first high-level political forum is a number of countries presenting voluntary reviews of progress. And these are voluntary. And so we're aware of 22 countries who've stepped forward already to say that they will be producing voluntary country reviews and thematic reviews. So that's what we can be expecting this year. And we've also included on the slide the program that's now available. Just to flag that the ministerial segment of the high-level political forum is later in the week, so it's the 18th to the 20th. And in terms of the clear outcome from this meeting, we're expecting a ministerial declaration to be adopted, And so that is the high-level political forum, which is obviously coming up in just next month. Next slide, please. But also what's been going on is that member states have been negotiating a resolution around the follow-up and review of the 2030 agenda, and this has been under silent procedure, so it's been hard to kind of find out the details, but this has just been released in a draft form. And so what the resolution says is that, as we have previously presented on webinars, the way that the Sustainable Development Goals are going to be reported at the high-level political forum is that certain goals are going to be reported on in certain years. And what we now know from this draft resolution is that each year a kind of subset of goals will be reported on. So as you can see from the slide, in 2017, and each year there will be a kind of overarching theme, which is fairly broad, but it tries to kind of tie the subset of goals being reported on together in some way. So 2017, we will be seeing the theme being discussed around eradicating poverty and promoting prosperity in a changing world. And then the goals to be reviewed on that year will be 1, 2, 3, 5, 9, 14, and 17. And for those wondering what on earth those numbers actually mean, Goal 1 is poverty, Goal 2 is nutrition, Goal 3, the most important one for us, is health. So this means that health will be reported on in 2017. Goal 5 is on gender, and there's also one on innovation, and every year, importantly, Goal 17 you'll see throughout each of the years is on the partnerships. So that will be reported on every year, and then we'll have specific goals being reported on each year. 2018, the theme will be around transformation towards sustainable and resilient societies. And the majority of these goals really focus on the environment. So we've got water, we've got energy, we've got cities, we've got consumption, and then you'll see again number 17, partnerships. So that's going to happen every single year. 2019, the theme is around empowering people and ensuring inclusiveness and equality. And the goals here to be reviewed will be education, jobs, inequities, climate, peace, and again, partnerships. So you can see that they've clustered them, trying to cluster them around kind of key themes. So I think 2017 is the year of kind of social development in a way, with poverty, nutrition, health, gender. 2018 more focusing on the environment, and then 2019 perhaps more around economic growth and inequality. So that's how we're going to be seeing the Sustainable Development Goals being reported into New York as far as we're aware so far. But I think it's important to say that obviously Goal 3 on health interlinks and cuts across many of these different goals and targets. So I think there is going to be an opportunity for us to be talking about health at every single high-level political forum. But obviously, because they need to be reporting on the different goals and targets in some coherent manner, this is how it's going to be structured. But I think all to say is 2017 for the health and the NCD community is going to be pivotal, but we will have an opportunity to be really promoting health and NCDs throughout all of these. And also just to mention, linked to this follow-up and review of the 2030 agenda, obviously as Alena presented earlier, at WHA, the resolution on Agenda 2030 stipulated that reporting on the Sustainable Development Goals, the health-related Sustainable Development Goals, will happen every 2 years at the World Health Assembly. So every 2 years at WHO on health-related goals, every year at the high-level political forum on the whole agenda, but within that they'll be focusing on specific goals. So I hope that's as clear as can be possible at the moment with the whole follow-up and review of the Sustainable Development Goals. Next slide, please. And then finally, just a few other elements of the draft resolution just to highlight. It also encourages a web-based platform to support participation by various regions and organizations. It also, importantly for civil society, calls for continued inclusive participation of the MAGE groups that have obviously been continuing to work together, and other stakeholders. So really trying to continue that inclusive nature of both the development of the Sustainable Development Goals and also the implementation. So I think we as civil society really need to be seeing this high-level political forum as an important opportunity for accountability for NCDs and health more broadly. So it's also an opportunity also to be working with governments to ensure NCDs are part of those national reviews. So as I said, they're voluntary reviews by governments, making sure that when we know which governments are going to be doing their national reviews, that they're talking about progress towards NCDs. And just to also highlight something that we'll be working on at the NCD Alliance over the next month or so, is that we'll be producing a table which really shows the links between NCDs and the SDGs. This has been done for many different issues, including the tobacco control community have already done theirs around tobacco control and SDGs. We'll be doing one more broadly about NCDs, which I think will be a useful advocacy tool for everybody. Next slide, please. Moving on to another update from New York. Just last week, next slide please, was the UN high-level meeting on HIV/AIDS. So this took place on the 8th to the 10th of June in New York. As all these high-level meetings are, it was very much a meeting of heads of state and government, quite impressive number of heads of state and governments, as well as obviously ministers of health. And the main focus and theme for this year's high-level meeting was really around reviewing progress, obviously, on reaching targets to end the AIDS epidemic. So very much the discourse in the AIDS community about ending AIDS by 2030. At the start of the high-level meeting, the political declaration was adopted. And this was the reason why we really wanted to focus on this in this webinar, is that it has really important implications for the NCD community again. This is the first time that an HIV/AIDS political declaration has actually included quite a strong focus on non-communicable diseases. Obviously HIV/AIDS and NCDs are both chronic conditions, so really trying to reinforce the linkages between the two and the opportunities from an advocacy perspective, but also from a service delivery and a prevention perspective as well. So you'll see that in 2011, at the last high-level, at the political declaration, on NCDs, the government's committed to, by 2015, to strengthen the advocacy, policy and programmatic links between HIV and NCDs. So it was raised in 2011 at the high-level summit on NCDs, but to date hasn't been a strong focus within the HIV/AIDS community. But what we saw just last week was that the political declaration included language around health being a precondition for an outcome of sustainable development and can only be achieved in the absence of both communicable diseases and non-communicable diseases. It also recognised the importance of integrated responses to address NCDs and HIV/AIDS together. And it also recognised the need to ensure the delivery of more integrated services for HIV/AIDS and NCDs, and it particularly focused on cervical cancer, drug dependence, food and nutrition support, maternal, child and adolescent health, as well as mental health. So I think taking a step back, this is a really important achievement and milestone for the NCD community. We at NCDA have been very much promoting the links between HIV/AIDS and NCDs. And now that this is in a political document that's been adopted by heads of state and heads of government, that provides us with a really important lever to be seeing progress in this area. So really good news in that regard. Also just to mention that UNAIDS has just recently developed a new strategy, and in that strategy there was also a strong focus on the need to highlight, the need for integrated care. So again, this is kind of a lead on from that new UNAIDS strategy. So good news in all, and obviously the high-level meeting on HIV/AIDS takes place just a month before the International AIDS Conference, which is happening in Durban in South Africa on the 18th of July. So this is an important kind of precursor to that International AIDS Conference as well. Next slide, please. Let's go to the next presentation, and then we'll take Q&A on all of these New York-based updates. So let me pass over to my colleague Jessica Beagley, who will give you an update on where we are on UN Habitat 3. Jess.
Hi everyone. So just a quick bit of background for people who aren't really aware of the links between urbanisation and NCDs, because I appreciate it's maybe not top of everybody's agenda. But I think this is a growing priority, so just to run quickly through why. So looking at urbanisation, over 50% of the world's population now lives in urban areas, so urbanization really is a priority even at the level of population that can be reached by health interventions. So to run through some of the issues, air pollution, for example, causes 7 million deaths every year, which, just to give some idea of the scale, is even more than physical activity, more than tobacco use, and more than deaths from harmful use of alcohol. And this is because of the emissions produced by industry, transport, and our increasing reliance on technology, especially in urban areas. It's due to both indoor and outdoor air pollution. And some of the diseases that result from air pollution include cardiovascular disease, respiratory diseases, and cancer. And some of the ways that we can combat air pollution are through the use of renewable energy for outdoor air pollution, but also making sure that there are clean household fuels, and that reduces indoor air pollution. There are also a number of co-benefit solutions that relate to other NCD risk factors, including physical inactivity even. So in urban areas, we see increasingly sedentary lifestyles with people working in office jobs. There's reduced leisure times due to the long hours that we all spend working and commuting, and a lack of space like green space and parks for physical activity. So this can be addressed through increased numbers of parks, especially in localities where people mainly live rather than work. Lots more on active transport, so interventions to support walking and cycling, and to make sure that they're safe and attractive options, and making sure that there are specific routes, that these aren't polluted, that they're green and easy to use, and then also through workplace wellness initiatives, which obviously applies to other risk factor interventions as well. Looking at poor nutrition, as urbanization increases, people spend more time at work and less time at home, so there's decreased time to cook, and we're more reliant on fast food. The number of deaths due to poor nutrition is in the millions. It's hard to quantify it exactly, but to give some idea of the numbers involved, hypertension, high blood glucose, overweight and obesity, and high cholesterol equate to roughly 15 million deaths every year. And in terms of solving this, we can look at options in sustainable agriculture. So there's reduced space in urban areas to grow fresh produce. This is an additional challenge. So we need new techniques to ensure that vegetables and fruits are grown and accessible in the coming decades. We can also invest in local public markets, which often have a much wider selection of healthy, fresh and affordable fruits and vegetables than you might find in supermarkets in lower middle income countries. Supermarkets do tend to have a better selection of food on offer in higher income countries. And then a wider topic is making sure that healthy food environments exist, especially around schools and areas where children are present, so no fast food restaurants near schools. Alena already mentioned the links between chemicals and NCDs, so there are well-established links between exposure to chemicals and cancer and neurological disorders. But there is an increasing focus on the impact on metabolic functions, which would lead to diabetes, and WHA WHA have been looking a little bit at that, so expecting to have more information in the future. And this can be combated through making sure that we've got responsible waste systems. And of course, tobacco use and the harmful use of alcohol issues everywhere, and in urban settings the prevalence of tobacco use and harmful use of alcohol is actually slightly lower. There's better evidence on that for tobacco use than there is for alcohol, but the issue here is very much looking at the fact that there are opportunities in urban settings to make sure that regulation is stringent and well implemented, whereas in rural areas things are slightly more informal. And also particularly regarding public spaces, people are closer together in urban environments, which means the risk of exposure to second-hand smoke is higher. And obviously issues around alcohol use and violence in public spaces as well. So I think from this you can see that urbanization draws together the 4 traditional NCD risk factors, but also risk factors that are likely to have an increasing impact and need recognition in future because of their impact on NCDs. There are many other health issues at hand as well, including injuries due to road traffic accidents and also water and sanitation. And all of these, whether NCD related or otherwise, are underpinned by the social determinants of health. And we see that in cities, the range of socio-economic status is even more polarized. We've often got the most affluent people living in proximity to people who are living in slums. So moving on to the next slide, just to give some background on Habitat 3 itself. This is the UN Conference on Housing and Sustainable Urban Development. There is one habitat conference every 20 years, and the next one is from the 17th to the 20th of October in Quito in Ecuador. So the decisions made are going to impact urban health for the next 2 decades, which I think is considerable. The outcome document will be the new urban agenda, and health is featured very poorly in the discussions and the official documents so far, but traction is growing, and WHO and a number of CSOs, including NCD Alliance, are advocating strongly. And there is an increased focus on health, but it's by no means sufficient. There is a zero draft of the new urban agenda available at the link you can see on that slide. Again, that link will be active once the slides are posted online. But we're very much interested in collaborating with anyone who wants to help us with this, as I will explain in the next slide. So we complain as the health community that the urban community is not focused on health, but largely nor is the health community focused on urbanization, and this really does need to change if we're going to have an effect. So urbanization is what draws together the majority of the NCD risk factors, is what I've said, and there is too much at stake to let this opportunity go without engaging. So we're developing civil society recommendations for the inclusion of health-specific language in the new urban agenda. And to this end, I'd be really grateful if you could email info@ncdalliance.org if you'd like to be involved in the development of these, or to sign on if you could follow the link also provided on the slide if you'd like to receive a copy of the final recommendations for you to consider signing on, just to emphasize that this isn't a commitment that you will sign on, but just an opportunity to stay in the loop. Language won't be included unless we've got considerable support, so really would appreciate everybody's engagement there. Thank you very much indeed.
Thanks, Jess. So a great opportunity to be putting into practice the integrated and indivisible nature of the Sustainable Development Goals, and making sure that NCDs in health are very much reflected in what's happening in the environment, in cities, in urban planning. We'll come to Q&A at the end. Let's go back to Alena for an update on the EAT Forum, which was taking place in Stockholm this week, as well as the launch of the Global Nutrition Report. Alena.
Thanks, Katie. Yeah, it's really good to be speaking after Jess. I think the EAT Forum certainly also has the ambition to look at the interlinkages between the different SDGs, and specifically the nexus of food, health, and sustainability. And EAT is really concerned with the question of what we eat and how we produce it, and this being the driver of some of the greatest health and environment challenges that we're seeing today, and specifically in the epidemic on the one hand, and climate change, deforestation, and loss of biodiversity on the other hand. The EAT Forum takes place, it was the third EAT Forum, it takes place every year in Stockholm, and brings together a really illustrious bunch of people, politicians, scientists, the UN system, civil society, business, small entrepreneurs, and more and more celebrity chefs to develop synergic solutions. And this year we had the president of Samoa, the former president of Ghana, the ministers of health of Norway and Sweden, the Princess Mette Marit of Denmark, the Crown Princess Victoria of Sweden, celebrity chef Jamie Oliver, and a couple of other celebrity chefs. So really kind of a high-level group of people, and it's great to see that these people are stepping up to become champions for nutrition and NCDs. One of the exciting things that was announced at the forum was the launch of the C40 Food Systems Network, and going back to the urban agenda and Habitat 3 that Jess was just talking about. This network will seek to help participating cities to achieve solutions to their most pressing food and nutrition challenges, and also impact the environmental challenges that they're facing. It's a great pleasure of attending a conference on accountability in nutrition, and looking more specifically on how to move forward in implementing the decade of action. And as you can see here at the bottom of the slide, there are several presenters: Alejandro Carrillo from Mexico, Jamie Oliver, championing soda taxes, and really putting NCDs front and center. I'm afraid I don't have all that much time, so I'll move on to the Global Nutrition Report, which was launched at the EAT Forum. Next slide, please. So the Global Nutrition Report is an annual report, and it assesses the country's progress in meeting global nutrition targets, and specifically those that were established by the World Health Assembly, and also commitments made at the Nutrition for Growth Summit in 2013. This year's Global Nutrition Report finds that malnutrition is on the rise in literally every single country in the world. 44% of countries with data available now experience very serious levels of both undernutrition and overweight and obesity. So 44% of all of the countries that were reported on have a double burden, if not a multiple burden of malnutrition. 1 in 12 people globally have diabetes, and nearly 2 billion are obese or overweight. 2/3 of countries have not made any progress on implementing the WHO core recommendations for healthy diets, which are very important in curbing NCDs. And 11% of GDP is lost every year in Africa and Asia due to malnutrition. And these are just very select findings that the report presents. The co-chair, one of the co-chairs of the Global Nutrition Report, Cornell Hawks, presented on these findings at EAT, and there are several launches taking place this week. Most of them have already taken place. There's 2 more outstanding, one in New York tomorrow, and then one in Beijing the day after, on June 17th. You can find more information on these launches on the Global Nutrition Report website. And that's it from EAT and from me for now.
Thank you, Alena. We'll now have a short Q&A based around those updates from New York and Habitat and the EAT Forum. We've had a couple of questions in. Firstly, Patricia Lambert is asking about the reporting pattern on Agenda 2030 into the high-level political forum. And the question is, will the pattern set for 2017 through to 2019 repeat in subsequent years, or will there be a review of the program of reporting after that first 3-year period? And the answer to that one is that yes, absolutely, there will be a review. So the last paragraph in the resolution talks about having a review of progress in implementing the present resolution on the format and organisational aspects of the high-level political forum after the first cycle. So basically after the 2017, 18 and 19 cycle, there will be a review and then it will be decided how to go forward in terms of reporting on the Agenda 2030. I should also mention, though, that in terms of the reporting, the resolution also mentions that there will be an annual progress report on the Sustainable Development Goals that will go to the high-level political forum, as well as a quadrennial Global Sustainable Development Report. So those 2 reports will also be useful, as well as obviously the high-level political forum and reporting on specific goals and targets for at least the next 3 years anyway. We also had a question from Craig Wall, which I was remiss to focus on earlier, which relates more back to the World Health Assembly. His question was around, based upon the World Health Assembly, are there any changes in priority focus for the NCD Alliance based on WHA activities? My own response to that, Craig, is that it's a great question. I think actually WHA really reinforced the priorities of the NCD Alliance, if anything. One of our major focuses for the WHA was to really try and promote countries to get serious about action on NCDs at the national level. We've seen a lot of great progress at the global level. To date, it's really yet to translate into concrete, sustained action at the national level. And I think that was a message that we were promoting through the World Health Assembly, and it will continue well beyond. I think the other interesting thing about the World Health Assembly this year is that actually a lot of the policy areas that were discussed were areas slightly outside of NCDs that we at NCDA are trying to build bridges and strengthen the linkages with. So for example, Alena was talking about nutrition, Jess was talking about habitat and air pollution being talked about at the World Health Assembly, as well as obviously the global strategy on women and children's health. And these are three areas that we're trying to strengthen the linkages and integrating NCDs into nutrition, air pollution, environment, and women and children's health. So again, that will continue. But as I mentioned, I think the other interesting part of the World Health Assembly was the amount of focus on the risk factors for NCDs, and so a lot of discussion around alcohol, obviously that call for a WHO framework convention on alcohol control, as well as a big push around physical inactivity, with a potential momentum around a potential resolution next year on physical activity. And so we at NCDA are very much focused on trying to strengthen the civil society organisations within these areas, as specific kind of priority areas as well. So just to respond to that question. I don't think we've got any other questions. We did have a comment earlier from David Patterson from IDLO, and he was mentioning that the GCM had actually talked about developing a community of practice on NCDs in the law, and it would be worth following up on that. So we will certainly follow up on that, David, in the coming weeks, because I haven't heard much about that recently. And with that, I think that draws us to the end of our webinar. So thank you very much for joining. We'll be having our next webinar in a couple of months' time. We will let you know the dates as soon as we have secured them, and look forward to speaking then. Thank you for joining. Goodbye.